So Kristen, just let me know when we're live.
You're streaming.
I am. How can you see it?
On the upper left, there's a little window that should say meeting is now streaming live on YouTube.
I don't see that, but okay.
You don't have it?
No.
Up next to the.
I see that too. Yeah.
I just have the encryption. Okay. We are live. I got it from Chris.
Okay. I was just going to say, if you can see my screen, I was going to show you how my desktop looked, but
it's not letting us.
Sure.
Oh my gosh, with your desktop. So anyway.
Oh my gosh, I know. Don't. It's terrible. I get so embarrassed.
Looks like mine. Don't be embarrassed.
No, not at all. I just get nervous.
The worst part is, though, I work for IT, and it's like the first thing you learn is like, don't store things to your desktop. Put them on your drive. I can't show how to show just the window, the meeting window. All right, sorry.
That's okay. All right, so I share my screen. We're going to call to order at, what time is it? 6:36. A little late, sorry. And we're going to rise for the Pledge of Allegiance as soon as I put my picture up. And I'm screen sharing desktop. Can you see it? All right.
Yep.
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. I'm going to stop the share. And so our agenda is pretty brief tonight. And I'm not sure if I was explaining this before you and Dr. Mohammed came on, Kebby. Joe is on the list. I think I did mention to you. He was still at work. So he said he was going to try to make it. If he's unable to make it, we might have to reschedule him. But okay. We have Dr. Mohammed who can update on the mobile clinic from Friday. So we can always, discuss that and discuss with Joe at a later time. And so roll call. Do you want to do that, Jean?
Heather.
Here.
Kebby Waterfield.
Present.
Dr. Amir Mohammed. I know he's here.
I'm here. Sorry.
And myself present. Kathy. And you say Joe. I don't know who Joe is.
Joe Soto is the emergency management director.
I'll wait because maybe he'll come on.
We can add him. If
necessary.
Because he's really presenting and he was kind of down a little, so he may just jump on.
Okay.
And Maureen is on vacation. Well, not on vacation. She has a couple days off. So did everyone get a copy of the minutes? And get a chance to review those?
Were the minutes sent along with the invite?
They were sent out, I thought earlier this week, but if not, I can send those or.
No, I have not received it. I just received the meeting invite. Thank you.
I can send those to you as long as, let me send them right now. Make sure everyone gets a chance to review those. And all right, I will.
I'll motion to waive the approval of minutes to the next meeting.
Thank you.
You're welcome.
Just going to say,
I need a second.
Jean or Dr. Mohammed? Okay.
All right.
Perfect.
I'm sure we're all in favor. Yes.
Yes.
All in favor. Yes. Because I thought I'd be able to easily pull it up, but I didn't. So let's move on to old business and continuing discussion regarding the COVID-19 and vaccination plan. I pulled up the current data today, and the West Haven numbers are definitely, as far as the vaccinations, steadily positively improving. I can share my screen just for what I saw. And I apologize, I wanted to send those out before. And Dr. Mohammed, I don't know if you have any thoughts or input you had as far as that, but I actually feel like we're definitely moving in the right direction. We're at 33. Is that, I know, compared to where we were, we're moving steadily in the correct direction. We've had some great clinics, and we outreach to the mobile clinics, which I was wanting to touch upon. And so, Dr. Mohammed, did you want to give any insight as far as the mobile clinic and how that went, and how it was accepted? No? Am I frozen? Oh, okay. I thought I was frozen.
I think Dr. Mohammed's still on mute.
I can hear you. He's muted.
Oh, okay. Dr. Mohammed, did you have any insight as far as the, you have no, I can't unmute.
Sorry,
Oh, you're unmuted.
yeah,
Oh,
I
but you
don't know,
still have no
I was
sound.
having a little bit of issue. Insight, no, so I think this is how majority of the town's data would look like, slowly rising because, the vaccine access is becoming available and many of the residents are also getting out elsewhere, not just through the health department. So it is expected. I think having ongoing clinics along supplemented with these mobile clinics will help us get to this susceptible or vulnerable population. If these are homebound and have difficulty, it's not very easy to get the appointments. Some residents have been complaining that they cannot get the appointment, and some do get an earlier appointment because we offer also one day of clinic per week, which is obviously you have to wait the next 7 days. So I think the strategy should be having a consistent offering available. I don't know operationally, how many shots Joe and Maureen have been able to give, but that mobile clinic that I went on Friday was, I think I was covering you, Heather. So basically it was like a very limited 25 people or so in that community, which I think, again, very targeted. We worked with the point of contact from the building authority. They had the list on. They made sure that people will show up. So again, it was like 100% taken up by the residents. So I quite honestly think that we have to keep on going it up at least till summer.
Yeah. And I think, and Kevin, I think you had known about this. We have scheduled a couple off hours clinics to try to get the people who are at work. It's going to be until 8 o'clock on the 23rd is one that's coming out, and there's going to be a Saturday coming out. So we're going to try to also get some time, and we're going to outreach to our citizens to try to get them in and to the shots that are available. And to answer your question, we've been doing anywhere from, this past week was 147 people on Monday that we saw. And that's about where we've been doing, about 150 to 200, if I'm not mistaken, at our clinics. And it's been happening that there is a clinic of some type now more than one time a week, which is great. There's been the Noble Street Clinic, the mobile clinic. Last week, I believe it was the Noble Street Clinic, the mobile clinic, and a homebound outreach all in 1 week. And they were all pretty successful. getting the shots in the arms. And I know we briefly touched upon before we went live, the challenge right now, not really a challenge, because we will have an option of, we do have Moderna, and I don't know the number we get allocated. I know that they were asking at one time for, I think, 300 and receiving 100 Moderna shots, and that's gone up slightly.
So I think the rationale behind that, it appears that the more shots that you administer, the more your supply gets increased by the state. So we can only benefit ourselves by keeping pushing those vaccines out. Now, we will also be able to avail ourselves of the Pfizer vaccine because of the governor. Is that further down on your agenda? Should I shut up?
No, but that was a question I had actually for you, because I knew you know that.
Yes, the governor's announcement that 16 and older can start receiving the vaccine, and they will prioritize alliance districts, of which we are one. So we should be able to avail ourselves of those Pfizer vaccines. Neil and Superintendent Cavallaro and Maureen, I believe, had an email conversation about who needed to be contacted at the state level, and they were going to work out some details on whether or not Maureen could assist in setting up a clinic on site at West Haven High School versus if we needed to work something else out based on the availability of staff at the health department. Obviously, we have school nurses that we could also utilize if necessary. It's nice to be able to do it when we have a captive audience. Basically, they're in school, and why not come down and get a vaccine? So hopefully we'll be able to work that out within the next couple of weeks. Right now it's school break, so there's no conversation going on about it. Neil's also away on vacation. The only other thing about that is that I did speak to Neil about kids under 18 are not allowed to receive vaccination without parental consent, and we can accommodate that consent form via the Power School portal, like we do with all other kinds of consents for prom and field trips and whatnot. So they're going to work on getting that consent available online for all those who use Power School, which is a very high percentage of the population, as well as I'm sure we'll be able to have some hard copies available for kids whose parents don't utilize the Power School portal. That was pretty much all I had about that.
I was just going to ask that because I had to be present to actually get Nora the vaccine. So
yeah, so we just have to figure out the logistics of that. And my question was going to be, as far as the Pfizer, the storage and everything, will we be able to maintain that if it is at the high school? Once it comes, because I know it's got to be held at a very
I'm not sure of all the details that Maureen and Neil were speaking of. I was only filled in on a really high level at the end of the week last week, but certainly that needs to be accommodated, or we need to make other arrangements. But we use Pfizer at a lot of our locations for vaccination that they come that morning. So it wouldn't have to be stored for a long period of time. They would bring the doses for the day. That's what we do at all of our clinics. They don't, they try not to store things for long periods of time outside central pharmacy. So
and I think I may have understood, and pretty similar to you, I just kind of got a brief, it's in the works kind of thing.
Exactly. There's nothing been settled yet.
That maybe there'll be a survey also of interest of what parents are going to want it for their children within school, because that's going to be important to know too, before we order what we order or get, to just know that we're going to have hopefully lots of willing arms. And I understand, and Dr. Mohammed, you may have this, I don't know if Kevin, this answer. They're very close to Pfizer being approved for younger ages. Is that accurate?
That's right. Yeah, 12 to 16, that gap, adolescents. So we will find out. I mean, again, they have submitted the data. It's been very effective in terms of expanding. So going back to storage, you mentioned the clinic. What are those settings that you use the daily dose?
If we do it this way, it'll be at the high school, I think is what's being considered. And
If we
that's
could do it at the high school, it's definitely that was one of the options, utilizing, they could set up at the gym. I don't know if there's mobile storage available, like that you could, work through the state. Like I said, I wasn't involved in any of the logistical conversations. Mine was merely like, how should we start the process? And I think that's where we're at. I think we're just starting the process. But I would not be surprised to see the 12 to 16 be approved before the end of the school year, considering, like I said, having kids with captive audience and a place to administer the vaccine, in a large amount of kids at a time. So I would bet that they try to get that through before the end of the school year, instead of trying to do it over the summer.
Yeah, and my understanding is, I think even just in my brief conversation with Maureen about it, is that the high school for this particular audience really would be the ideal location, because like you said, captive audience, they're there. I mean, we do have to talk about the logistical. Do the parents, like Jean said, have to be there? In which case, we just have to figure out the logistics of it, the storage. But I think it would be really great if we can get that in our high school. And
right. So Kebby, you mentioned that you're using these are clinic sites, or sorry, I didn't get that.
I work for Yale, so I was just likening it to what we do with our right. Yale New Haven clinic sites.
From the main hospital storage or the pharmacy, they deliver it at the site in the morning for the day, so they all are ready. And some, obviously because of the high flow, you end up using everything, right?
Yeah. Well, they send the doses that are scheduled for the day.
Right.
And obviously there's a certain number per vial, but they try to send no more, no less. So they, right. don't take them out of the, initial storage. So they get used within that time frame. And we also have pharmacists on site that are diluting and drawing up, and they deliver them to like the stations already drawn up in the syringes.
Okay. Yeah. The other thing that I have been advising, because we haven't received any Pfizer vaccine, and I don't know if with the new storage, is also that schools can also partner with healthcare systems, Yale, Griffin, whoever. My understanding is the superintendent to Amity mentioned that I think schools in nearby districts have already reached out to Yale and other healthcare systems. So they're offering, which is again, very feasible, convenient if that can happen, and health department as a backup while we're trying to get so it all depends, like, with personnel, with other logistical issues. But once, I think once the age criteria is lower, then obviously the throughput will improve for the vaccine supply. And, these healthcare systems will be jumping in.
And I think doctors' offices are going to start being able to vaccinate as well, because I know I've heard talk about some private practice / clinics, not vaccine clinics, but actual, PCC clinics, putting in to be vaccinators and getting doses of vaccine. So sure, I don't know how this Johnson & Johnson thing will play out, though, based on how long that runs.
Right. I mean, either or. I think Pfizer has the most strict temperature control criteria, as far as I know. Others can be so. Like any other vaccines being stored at a pediatrician office or internal medicine clinic or others, if the regulations will still be like that, and they allow that, I don't see any reason why not. But I also think that at least up until summer, we need to, as a local health departments, need to keep that offering going. Because of the convenience, access, and many issues. So again, if we had such a, not everybody goes to their or have their primary care doctors and what have you. So I think it will balance it out, at least for the first couple of years, when people have more awareness, better access, to reach out from different angles. So let's see. Yeah, I mean, it's still in the works. We'll see what happens.
And I know, just my understanding is after that first mobile clinic last Friday, and that it did, it went really well. And the homebound effort, I want to say they were able to get to 17 people they started with, and it went very smoothly. I was hoping, to hear it from, Joe directly, but I did understand that they split up the city with 2 teams and went out and were able to really effectively get those 17 people. It was obviously well received overall. People were very happy to, who were unable to get out, to have it come in. They did use the Johnson & Johnson. And if we have to pivot to the Moderna, I guess, that's what we'll have to do. But I'd be willing to bet, hopefully, that once they convene, they're going to release this pause. And because I believe it's 6 people out of several million, if I'm not mistaken.
Did we administer any J&J?
We did.
Do we have a plan to reach out to those who received that vaccine, to have them monitor themselves for the symptoms like the abdominal pain, the nausea, all those things that they should seek medical treatment for, related to the potential for the blood clotting?
I would defer to you, Dr. Mohammed, with that, because I know I haven't touched base with Maureen directly about that today.
Yeah, nothing. You mean on Friday, if we talked about it or not? Yeah, we usually do not. I mean, I think since it's something really, really latest that came across, from the advisory sense, when they receive the vaccine, the typical is like, injection site, body ache, muscle, nothing specific about the venous thrombosis or something like that. But in general, I think the communication should be, okay, well, if you notice something really new or different, you must contact your care provider, health provider, something on that note. Now that we have to include that, And
maybe that would be a good thing to just even put on the Facebook page, to just say, we recognize that there are people who have received, or something to the, I don't know about that, but just that they need to understand they need to go to their healthcare provider if they have any concerns at all, because I want to say, do you know, Dr. Mohammed, was it was Johnson & Johnson Friday, and then there was the 17 on Saturday. So those were it. So that would be about maybe 50 people, I think, affected.
Maybe it's something we can talk to Maureen about, utilizing the contact tracers to reach out to those folks that did receive it. Because usually I think from what I was seeing on the news and hearing today at work, it's like a 6 to 13. It's day 6 to day 13 when those symptoms potentially start to appear. So, and I'm not sure if everyone's aware of, I mean, we're obviously we're all hyper aware of anything that's about vaccines, tuning into hearing about that on the news. So
right, it's within 2 weeks that symptoms may appear that could be attributed to vaccines. I've had people saying, hey, I develop a rash in my foot or somewhere, totally inconsistent. No, that doesn't happen, right? It could be something else. And don't forget, people can get infected even after getting their vaccine. So, so the issue, again, this is because of the issue and the time that we are in. Anything, this is more advisory. It's a very, very, very rare incidence that happens. AstraZeneca was the first one. I mean, they use a similar platform, but it's still, there's difference between what we're using here in Johnson & Johnson and what used in Europe. Despite that, they still kind of okayed it to use it because it's a very rare incident to have those cerebral venous thrombosis. So thank God I haven't witnessed any. I mean, again, I've had a lot of folks telling me about their experience after second dose of Moderna or Pfizer. So the second dose really knocks you down. But with one dose, not that much. People didn't even, it also depends on everyone's genetic and personal makeup, how quickly they get affected. But to address this issue, I think for awareness purposes, I think Now we just have to add on when if it gets approved and we resume that, we just need to keep an eye on these specific symptoms like headache and others. And now we have to probably screen a little bit more effectively. This is among those commonly having factor V Leiden deficiency or any thrombotic pathway that is abnormal with low platelets and all that. So we need to kind of get a little bit more careful. Yeah.
So I think what Kevin said, I think for action going forward, we just need to make sure, see if Maureen thinks that perhaps the contact tracers, maybe the health department can reach out just for those few people who may be affected that have received the Johnson & Johnson. It's not a lot compared to what we have given. I will also say, we were just actually speaking yesterday at the clinic. We've administered, I want to say, at least close to 2,000 doses, if not maybe more, but I'm literally estimating. We've only had like 2 incidences of people just really not feeling well. It's been very few and far between in those 15 minutes immediate after. And they are monitored pretty closely. So that's also positive. So as far as, did anyone else have anything else as far as what we've been doing, what we're going to do? Like you said, Kevin, upcoming is definitely going to be getting the school kids and where we're going from here. Any discussion about that?
No, but I think to your point right before that is that I think it's really important to, when you speak to people about the vaccine, is that you differentiate between an immediate adverse reaction to an immune response reaction that is very different. Like if you're feeling terrible, it's not nice to feel terrible, but that means that your vaccine is working and your immune response is hardy, rather than, you just got the shot and now you're hiving and having trouble breathing. I think I just made up a verb, hiving. Having trouble breathing. I think sometimes people think like, oh, I had a terrible reaction to the immunization. Well, no, you had a great reaction to the immunization. Those spike proteins are killing it for you. Yeah. So I think especially when we talk to our friends and family members, to make sure that they understand the difference between an adverse reaction and an immune response.
And that's, at the vaccine clinics all day, you hear us all kind of talking, and I think we're all saying that, we're like, we're sorry, we do have to go over these side effects, but the good news is this means your immune system is doing what it's supposed to do. And if you really think about it, we're so focused on it right now because we're, doing the COVID-19 vaccines, but when you get the shingle vaccines, you don't feel so fantastic after that either. The same with the flu vaccines. Your immune system is reacting, like you said, exactly how it's supposed to. So it's actually good news.
I'm gonna just pop away for a second. Someone's at my door.
It's just not pleasant news. So anyone else have anything about our vaccine plan, COVID-19 plan, our data, anything? The only other thing I, had put on the agenda, I wanted to make sure I mentioned under new business, the West Haven Prevention Council. I was looking at the dates today. I got involved right at the beginning because as involvement in the PTA at the high school, I offered to be a parent representative on the West Haven Prevention Council. So our first meeting was in August of 2020. It's continued to grow pretty much ever since. And Maureen is a member. There's 12 sectors, including government, health services, community groups. There's several, including the school department, several sectors representative, all 12 actually, but several people in each of the sectors. And I wanted to make sure I mentioned it here because I think that it would be great to hear directly from the Prevention Council. I'd like to invite them to come and sort of present what they're about because they can obviously explain it way better than me at our next meeting. Nicole.
Sorry to interrupt, but Kathy Tucker's in the waiting room. You gotta let her. You gotta let her in.
Oh, Kristen.
How'd you even see that?
She texted
She
you?
texted me.
Oh,
Oh, Kristen also sent me the minutes.
Sorry, Kath. I just got your text. I just noticed it. There you
Okay,
are.
just texting.
Hi. So
Hi.
sorry.
I'm
Hi.
sorry, Kathy. I didn't even know you were out there. I was just texting Kristen. Sorry about that.
That's okay. That's all right.
So I was just discussing the West Haven Prevention Council. So we formed it's now like 8 months ago. I actually was a parent representative, and just also obviously happens that I'm on the Board of Health. We do have a representative. Maureen's a representative from the Board of Health, but I'd love to have them come and present what they've done in just these first 8 months, right? Yeah, 8 months. In starting, we've done a lot of programs already. There's been some billboards up. They've sent some surveys to the schools. They're working on getting a youth sector started and represented. It's just been a little difficult with that piece just because of the whole global pandemic and quarantines and everything. But Mackenzie Gardner is the representative of that. And I'd like to have Nicole Wiley, is her name, is the director of the West Haven Prevention Council. She's newly hired as a director there. And I'd like her to sort of present what the West Haven Prevention Council is about. And it's really, substance abuse prevention within our community and directed towards our community specifically. So that was kind of why I had put that on for new business, if anyone has any thoughts about that.
I think it's a great idea if she wants to take that on and come and talk to us. And the opioid crisis hasn't been in the news as much because of the pandemic, but still a global crisis, or at least a national crisis, and from everything that I've heard about it. So if there's a way that we can assist them, or we can partner together to use education and treatment and recommendations, or whatever we can do, I think it's a great idea. And
it's even more, honestly, than the substance abuse, because we're seeing with the pandemic, it was already a huge issue, and now with the pandemic it's even worsening, because some people are coping with substances. Yep. Plus the mental health piece.
Well, a lot of those go hand in hand with, right, self-medicating for mental health issues. So certainly, yeah, I think I approve all partnerships where we can work together for the common good.
Yeah. And there's some great folks involved. And I can give you a very very broad overview, just that it's it's been great at sort of trying to focus in on what our issues are specifically to West Haven, and they've been going into and educating different establishments, whether it's the liquor stores or the restaurants, have become partners with them. This mentioned prevention to curb underage drinking, not serving to younger, to minors. So in just this brief time, they've already really done a lot in our community. And I just think it would be great if, we all knew a little bit more, and not for me, because
Yeah, no, I agree with Heather. Whenever I hear the word prevention, I get excited. I'm a preventive medicine physician as well. So
Yeah.
this is the key, you know, anything we can partners with, whatever we can do in terms of education, awareness, all that would go hand in hand. Thank you.
All right. So I will ask her to come next month, the second. I don't have-
Hopefully at some point that'll be the only thing that we're talking about
Oh,
instead
that
of
would be lovely.
COVID vaccines. And
Yeah. And Kathy, I'm so sorry I left you out there for our conversation about the COVID-19 and the vaccines. Was there anything that you wanted to address as far as? Oh, you're on mute.
Sorry about that. I need a T-shirt that says you're on mute because that's. Hi, Dr. Mohammed. I'm Kathy Tucker. Sorry, I'm late to the meeting, and I guess I'm just going to follow along at this point. I missed a lot of what you talked about, and honestly, as far as COVID-19 goes, I'm really probably over it as well. You know, that's been like a real tough topic for me. So I'm just kind of, I'm just going to hang out.
you're over it more than any of us, Kath.
Yeah. So, but I'm listening. I'm paying attention.
Can I, are you okay if I share with Dr. Mohammed?
Sure.
Your loss?
Sure.
Kathy lost her husband to COVID-19, so she's experienced it personally.
Yeah.
Sorry to hear for your loss, Kathy.
Thank you.
May God give you enough strength. I know it's been, you know, personal to many. I've had some friends, you know, other known people. So it's a really terrible situation. Like at least each one of us would know somebody, right, with their friends or family. So that's the reason why we all need to hold hand, and you would be our, you know, spokesperson to see what you witness and why is it so serious, you know, especially among other community, right, minority community, that we have heard that there's some reluctancy or hesitancy.
Yeah.
This is, you know, I see that in hospital, right, all age group. I see that whenever I'm attending in inpatient settings. So it's not something that is going to select only few demographics, right? So
yeah.
It's there, and we all need to work in a team to keep ensure. So sorry again for your loss. I know time is the only remedy.
Yeah. So thank you. And I mean, I'm open to that. I think I'm still just moving through those phases of like grief right now myself. And so it's hard for me to kind of speak to it. And I, you know, when I will, and I have been, you know, speaking individually, I don't know if I even have, you know, right, the voice to give it yet, like at that level. But I'm definitely an advocate, obviously, for the vaccine. Doesn't help the whole J&J thing today. Didn't help the conversation. That really kind of like, and especially that was a target for the Black community. You know, a lot of people were, the Black and brown communities, that people are saying, you know, get the J&J vaccine. It's just one shot. You know, we could put it on the mobile vans. We could bring it into the community, and, you know, the whole thing. And it's like, you know, there's already such mistrust and legit mistrust, and then that. So I'm very careful about, and I think I shared this on the last meeting that we're on, about being such a staunch advocate for any vaccine. You know, I'm for vaccines. I'm not an anti-vaxxer in any way, shape, form, or fashion, but I'm also cautious, and I think have enough knowledge to know and understand that this is all still experimental at this point, and don't therefore want to be responsible for the one that's out there saying, oh, get it. And then something like this today, you know, becomes the example that kind of like, you know, solidifies their mistrust. And then here I am, someone that was advocating so hard for it, and my credibility is therefore shot, you know?
I would say this, don't think that your credibility is compromised by any means, quite frankly, because, you know, we all are in the same, as a frontline healthcare workers. Now, to say that experimental, there's always any medication that comes out, regardless of vaccine or aspirin or anything that gets, you know, approved. It still isn't experimental, okay, for several years, because that CDC and FDA collects the data and all that thing. So the narrative would be, okay, well, how did we get rid of polio? How did we get rid of measles? How did we get rid of yellow fever? Or, you know, that all came through that same process.
Oh, absolutely.
Now, six cases out of 3.6 million doses or 6 million doses. I forget the number. It's like, you're talking about again, yeah, this is a good thing that we have the capability of getting those reports. I encourage, like, some of the residents, I was talking to Heather, had some weird, responses. I said, look, we have the vaccine adverse event reporting system, report it. Thank God there's no fatality for, that's the most important thing, receiving the vaccine and all that. We have had some reports coming in, medical doctor or somebody, I forget which country was this, but they passed or they died after. So all I'm saying is it's experimental is a very
it's a dangerous way to describe it.
Yeah, just to see things, because any medication that comes onto the market would have, by law and regulations, would need to be still monitored. So the labeling, exactly, the selling point is not that this is what they got. I mean, the fact that they were able to make it so quickly is, we are talking about 21st century, 2021, not 18th century or 19th century, when polio and other things took a while and a lot of people. So I think there's a blessing, with any sufferings. That's how God has sort of, reminded us again and again. I would say this, that, brown community as well, they are very questionable and all that. So I can attest to you that, personally speaking, I've had patients endorsing that I don't want to go through this again. Some reports have been published, early reports and all that, saying that those who have had the COVID disease or illness themselves, and then they receive the vaccine, after a certain time, their symptoms improve. The long hauler, right? The long hauler with the COVID symptoms. So there is some benefit also in encouraging people who have been infected and saying, oh, you know what, I got already infected. That's it. So all those things, I think, is just how we communicate. And I hear your, so don't think, Kathy, that your credibility is at any point of time would be compromised, because you are with the healthcare team, you are saying what you are seeing. So this is a very responsible view of looking at it, analyzing the data. It's a rare entity anyway. We in my very humble experience, where we have only given maybe 200 doses, all that for J&J, but another 1,000 doses from other vaccines. Thankfully, nobody had severe reaction to be hospitalized. So keep up the good work. Your heart and your intentions are right, and that's what I believe. When you speak from your heart, that's when you connect with people, and that's what matters.
No, thank you for that, and I appreciate that, and I really do appreciate the clarification, and I just want to be careful. I want to be careful with the words that I choose, because I do know how important it is to be vaccinated, and I am an advocate for vaccination, especially for COVID-19. So I don't want to misrepresent, the way that I'm kind of processing this. So thank you for, that clarification, and I stand corrected.
Dr. Balsazak on a town hall recently made a point, and I wish I could remember exactly what he said, but he referred to it more as a risk benefit versus experimental, for lack of a better word, because I don't think that was what he used. But, the risk benefit to getting the vaccine versus getting COVID is so different. And the fact that, there are adverse reactions to everything. How many women have developed blood clots taking birth control pills, oral contraceptives, yet they are still taking them by, in massive quantities. And yet, the risk benefit of that is much different than risk benefit. Those of us who have kids know sometimes, maybe COVID might have been an easier course, but so I think, and I joke with some of my, I think you need to know your audience too. Like, I joke with some people and say, like, they're like, oh, I don't want to put that, I don't know what's in there. I don't want to put that in my body. And I'm like, I see you eat Pop-Tarts and hot dogs and Diet Coke. Like, don't tell me that you're worried. I'm like, don't tell me that you're worried about what you're putting in your body. Like, that's your argument. So, and they'll laugh, but some people are really scared. So I think you need to, like you said, know your audience and know, what might help them become quicker to yes. I'm using that Yale terminology.
Yeah. No, that's right. It's a risk and benefit. The risk of getting the vaccine is still much lower compared to the risk of getting the infection, and the benefit is still much higher. So that's a trade-off. Any medication, be it like high blood pressure medication that we commonly use, there are some side effects. There's going to be, but again, the risk of dying from the stroke or heart attack is far greater. That kind of, overlook why you can manage some of the other. So it's always going to be the case. It's just the way it is. Unfortunately, you're right. We just have to know the audience, put things into perspective so they can understand. Everybody, they cannot. If I start speaking in medical lingo, I've lost the communication. So I remind myself who I'm talking. I mean, obviously talking to you guys is different than if my neighbor is calling me and saying, "Hey, what do you think?" One of a colleague received, her son received a vaccine about a month ago, a male, and then she realized, oh yeah, my son is a boy. So the health effects were happening in the female, right? You're right. The risk of even the birth control pills or OCPs or hormonal replacement therapy, which used to be given to women, right, postmenopausal to reduce symptoms, have shown to cause blood clot. So yeah, you're right. I mean, I'm just glad that we live where we can track these things. I mean, there are many other areas, part of the world, that they are having issues and that mortality is, going high. So let's hope for the best. I'm hoping that so many people have benefited from one dose. It's amazing. I myself got one dose when it was available. So obviously, nobody likes to get jabbed times two. So if you have it, get it done. So we shall see. Let's remain hopeful that the advisory committee would look into details. We don't know these 6 women, what sort of medical history they had. As a medical provider myself, researcher, I would like to know the detail of it, right? So let's hope things will clarify. Yeah, it's a little dent, I would say, in approach, but I would surely not say that, okay, well, this is the last nail in the coffin, something like that, you're
yeah, the one thing I do share with people is that you don't want to get COVID, because we don't know what the long-term effects are. Even if you do recover from it, you still don't know what having had it means for us, So I just always kind of couch it that way. Like, it's better not to ever get it if you can never get it, but if you do, you certainly don't want to end up having the really severe outcomes or death as a result of having had it.
And quite frankly, my selling point is always, as a pitch, hospitalization, mortality, right, and severe infection. These 3 outcome have been consistently shown by all 3 vaccines to prevent that, and that's all I care.
Yeah.
Mild reactions and other things are going to be variable, with different people. You may have different reaction to Cabby or Gene or whatever, but that's different. But what has been consistent is the hospitalization, mortality, and severe reaction. So I think that's sort of, you're right, you're 100% right. You don't know what the outcome would be once you get infected.
Right.
And it's funny that, sorry, Heather, go ahead.
No, I was just going to say, I wanted to add, my first instinct this morning when I saw the news about the Johnson & Johnson was like, oh my gosh, this is so horrible, and, everything. And then I was like, wait a minute, there's 6 out of millions. How great is it that they just said, you know what, we're going to stop and we're going to look at this. They're not saying we're throwing it away. They're just saying, we're going to stop. We're going to look at this. We're going to be responsible. I actually, in hindsight, once I calmed myself down, had a little more confidence in the fact that they are watching that way and looking at it. It gave me a little more comfort, honestly.
Right.
One of the things I tell people about is that when we were watching the hospitalizations all through the horrible spring last year, and then even over the summer and through the fall, is that, we had a lot of older folks hospitalized with COVID. And now when we're looking at the patients that are hospitalized with COVID, they are young younger patients. And
Yep.
clearly we've vaccinated a lot of those older populations. So although it's not, scientifically plotted out anywhere, at least that I've seen, I'm sure it is somewhere,
Yeah.
but, anecdotally showing that the vaccine is working.
Sure, less transmission. You're right. I think you can extrapolate those data points and say, yeah, we focused on all these. We have still some older people are still getting infected. I've seen 80, 90-year-old, that's going to happen. That's not going to stop. But at the massive level, right? So now we don't have any, or at least younger people not following the public health guidelines. That's what we've seen the spike among that specific age group, right? Kids are still getting it, right, in private games and hockeys and what have you. You probably know that Maureen and I struggle with all those things because, these private sports are there. Kids get to be quarantined and all that. So it's going to be up and down kind of. But the massive aspect of, what I hope is basically we have some breakthroughs, right? People who got the vaccine still develop infection, but to the milder sort of symptoms. I know one person in town a healthcare worker who had 2 doses, but still was tested positive, not because of symptoms, just because one of the household member became positive and she was sort of, contact. So didn't feel anything in terms of, again, anecdotally, but came back positive, which you would expect that. So I think there are many things. Yeah, you're right. I
think that was my experience because I had the first dose of the vaccine when my husband got sick. I got it in the end of December and he got sick maybe a couple weeks later. And then I got it as a result of him having had it. But I had no symptoms, very, very slight, if any, at all symptoms, whereas he had the severe case. So, and that was only after 1 dose. So I was sure to get the second dose after that.
Right.
Yeah.
And, I thought it was interesting. You were saying that made me think. So my daughter's fiance just tested positive for COVID about 3 weeks ago. And my daughter is a healthcare worker, so she's been double vaccinated for some time. And she works not at Yale, but in another area. And they made sure they tested her day 1, day 7, day 14. And I was like, why are they doing that? But I think part of it too is gathering the data too, to see, because they do live together. So she's been negative, but I think that we're going to learn that perhaps there are some people who are positive, but it's going to be exactly that, where they're not symptomatic.
Yeah.
And therefore won't be able to spread further. That's
Right.
Cut the chain of transmission. That's the key.
Yeah.
So hopefully, I think, I was really worried when state all of a sudden opened up, right? We were not going to the phase in government. I was really, really concerned. And perhaps that's the reason why we're seeing some cases also going up in many, towns. And although the vaccination rate has picked up, but at the same time, infection is going there too, right? So, and I was trying to get, want people, you especially, some of the community members, I'm like, look, this is a time you want to get protected because who knows when you step out of the door, right? All bets are off.
Yeah. It's true.
So I guess, we're actually 7:30. So I think in closing, we do have some, by next month, I think we'll know what the students, are we going to get into the schools? It might have even already happened by then. Who knows what's going to, and we'll have the prevention council here for the next meeting, and we'll keep watching that data to see, hopefully we keep going in the right direction. Any other thoughts as we close?
Nice to finally meet you.
Pleasure meeting all of you.
Yeah, it's nice to meet you, Dr. Muhammad.
Likewise. Heather was very kind to kind of get me updated on the talking points that you guys were discussing. So I would, like I said, I was teaching a class, so we are in a recess, spring recess. So my plan is to kind of continue to participate. So thank you for having me. And if I could be of any help or any questions, please, feel free to reach out to me.
Dr. Muhammad, where do you work? if you don't mind me asking.
Oh, no. I wear multiple hats. So I live in Orange, so I'm also their part-time health director. And I work at the VA mostly. That's my full-time, but I do have clinical privileges at Griffin, where I do some moonlighting at times in an inpatient setting. So I am preventive medicine, public health, and internal medicine. So I try to keep all my skills active, and which is at times challenging
Yeah.
to say the least. But it's thankfully I don't have to travel that far. All the other opportunities are within the 10-mile radius. I used to be at Yale, obviously when I was training there, did some work as well, but now I'm fully sort of last year, it seems like my health department job is taking more time and effort than anything else.
Yes.
I'm working like 12 hours a day almost, to cover my initial responsibility and, teaching. So yeah, this semester I was asked to teach at UConn also, obviously through remote.
Yeah.
But yeah, I try to keep myself busy.
Okay. All right. Well, it's good to meet you.
Likewise.
So people are saying like, well, why did you get vaccinated? And I had a whole litany of reasons. And one of them was, me and my friends are tired. That's why
Yeah.
I want you to get vaccinated.
God.
We're
Exactly.
tired.
Absolutely.
Exactly.
Yeah. All right. Well, I guess I will take a motion to adjourn. Kevin and Kathy. Thank you everyone so much, and we'll see each other in a month.
Thanks. Great job, Heather.
Thanks. Have a great night.